Hi, this is my intramuscular return video. I'm in the correct uniform. I have my name badge, my watch, my pen and pen light, my stethoscope here. I'm in the correct uniform, hair is back, and I'm going to show you around my workspace. So this is where the camera is going to be. That's the background. There's my daddy, and this is where I'm working. Okay, alrighty, so now I'm going to begin. I'm walking into the med room and I'm going to wash my hands. Alright, washing them nice and thoroughly. Now I'm going to locate my MAR. So I have my MAR here. It states that I'm going to be administering 0.9% sodium chloride, so I'm going to locate my vial. Okay, so looking for 0.9% sodium chloride. Alright, so that's what I have here. I'm going to go ahead and check the expiration dates. So this vial expires May of 2023. It's a single dose, so it's for a one-time use, and I'm going to throw it out after I'm done. And now I'm going to perform my first round of 6 rites. So I have the correct patient, Vinny ventrogluteal, the correct drug, 0.9% sodium chloride. That's what I have here. I'm going to be administering 1.2 milliliters, intramuscular. The time is stat, and I'm going to document later. Okay, so now I'm going to go ahead and make up my label. Patient name, Vinny ventrogluteal. Drug, 0.9% sodium chloride. The amount, 1.2 milliliters, added by my initials, followed by SN for student nurse. The date today, 4/22/20. Expiration date is 05/2023. Okay, the time right now, I have 11 a.m. and the route is intramuscular. Okay, just gonna double check. So Vinny ventrogluteal, drug 0.9% sodium chloride, 1.2 milliliters, my initials, the date, the expiration date, time 1100, and route intramuscular. Okay. Okay, so I have that. I'll put that on my syringe in a little while. And now I'm gonna pick out the syringes, the syringe I'm gonna use, and the needle sizes, making sure they're appropriate. So I have this safety device, so Luer lock syringe. It holds up to 3 milliliters of solution, and then it has the needle size is 23 gauge, 1 inch. So I'm going to initially drop the medication with this one, but then I'm going to change out the needle because this will become dull and after I drop, and so I'm going to be using this needle size 21 gauge, 1 inch. So those are appropriate. Now I'm going to open up my syringe, maintaining sterility. Okay, so I have that. Alrighty, so I'm going to go ahead and I'm administering 1.2 milliliters, so I'm going to drop 1.2 milliliters of air that I'm going to put back into the vial. Okay, so I have that. I'm just going to lay this here. Alrighty, so I'm going to cleanse off the top of the vial here with a new alcohol wipe. I don't have any more, but we're going to pretend this is new. Okay, for 15 seconds, starting now. Okay, now I'm going to take off the cap, move this away. I'm going to inject the air, bullseye, inject the air. Turn it upside down. Alright, so making sure okay, drawing down more than I need so that I can draw back on some, or push out any bubbles I need. So give it a few flicks here. Getting any bubbles to the top so I can push it out. Keep trying. Gonna get it. Gonna get it. Okay. Now I'm going to push up to okay. So now I'm going to go like that, draw out, engage the needle. Okay, and now maintaining sterility, I'm going to take off this part right here, and so making sure I'm not touching the green part when I'm taking this off. So okay, and I'm going to put that on. Alrighty. Make sure it's snug on there. Okay, now I'm going to go ahead and perform my second round of 6 rights. Okay, so comparing my label here with my syringe and my MAR. Alright, so I have the right patient, Vinny ventrogluteal. Okay, I have the correct drug, so 0.9% sodium chloride. This is the bottle I just used to draw up what's in here, so that is good. Administering 1.2 milliliters, so making sure that I have, okay, it's right on that line there. And the route is intramuscular, and I also have the right amount written on here too. And the time is stat, so as soon as possible, and I'm going to document later. Okay, so now I'm going to put on this label here. Okay, so I have the label on, did my second 6 rights, and now I'm going to gather my materials to go to the patient's room. So I'm bringing my MAR, my syringe here, and I'll bring my vial as well, and have gloves. Okay, this is my patient today, and this is the patient's wristband. Alrighty. So walking down to the patient's room, and now I'm entering. I'm going to wash my hands. Introduce myself. Hi, my name's McKayla. I'm going to be your nurse today. How are you? Oh, I'm good. Alright. So once I've washed my hands, now I'm going to verify the patient's name, date of birth, and any allergies, looking at my MAR and the patient's wristband. Okay. So can you please verify for me your name and date of birth? Sure. It is Vinny ventrogluteal 11/3/55. Okay, gonna check there. That looks good, and that's what it says on my MAR. And Vinny, are you aware of any allergies? No, no allergies. Okay, no known allergies and no known allergies. All right. So today, Vinny, I'm going to be administering your sodium chloride medication into your upper thigh. Should be quick and easy, but please let me know if you feel any discomfort at any time. Do you have any questions? No? Okay. So now I'm going to perform my last patient rights by the bedside table, comparing it with my MAR and my syringe here, and this file. Okay, so I have the correct patient, Vinny ventrogluteal. That's what's on my label, and that's what they just said aloud. I have the correct medication, so 0.9% sodium chloride. That's what it says on the label here, and that's also what I have here. All right, so I'm going to be administering 1.2 milliliters. That's what I have here on the label, and I'm going to double check. That's what I have here as well. Okay, so the route is intramuscular, and the time is stat. Okay, and I'm going to document later. All right, now I'm going to show you my correct amount and label and the vial I used. Okay, so the amount and oops, it's my label. Okay, and that's what I used today. All right, so now that the instructor has seen those, I'm going to go ahead and prepare my alcohol pad. So taking this out, pretending it's a brand new one. Okay, so leaving that there, and then I'm going to get this loose. Okay, so that is good. I'm going to go ahead and put it right there. Alrighty, now I'm going to go ahead and put on my gloves. Okay, and I'm going to expose the vastus lateralis. So the vastus lateralis is located on the anterior lateral portion of the thigh, and you locate it by, so it's a hand's width, handbreadth down from the greater trochanter and a hand width above the knee, and then you divide the anterior part of the thigh in half, and then also the lateral part, and then forms like a middle area triangle. Within that, you're going to envision 3 longitudinal lines, and it's going to be in that third box there, like rectangle that those lines made. Okay, so I've located the site. Now I'm going to pull back, forming that Z track, and I'm going to cleanse with my alcohol wipe here, starting inwards, working my way outwards, holding in a circular motion. Okay, I'm going to let that dry, and so I'm going to be darting in at a 90-degree angle, and holding the Z-track. I'm going to let the patient know that there's going to be a little poke. So Vinny, you're going to feel a little poke in just a second. There we go. Okay, so Vinny, you're going to feel the poke. All right, now I'm going to aspirate for 5 to 10 seconds, seeing if I see any blood. Okay, no blood is present, so now I can press down, and I'm going to do it slowly, 5 to 10 seconds per milliliter. Okay, now I'm going to hold for 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. I'm going to withdraw the needle and engage the safety. Let go of the Z-track. Put this into the sharps container, and I'm going to look for any oozing or blood, and take a gauze pad here and just lightly, not massaging. Okay, Vinny, how was that? Oh, it was fine. All right, I'm gonna clean up my materials. Throw this away. Okay. Wash my hands. All right. So, today I did it into the vastus lateralis. However, we can do it in other sites. So I'm going to show you now. The deltoid. So how you'll find that is it has to be above the armpit here, and then 2 or 3 fingers rest from the acromion process, and then you're going to form an upside down V, and it's in the middle there. The other one is the ventrogluteal site, and so I would use my right hand if I were trying to find the placement on the left side of the patient, and putting my heel of my hand here into the greater trochanter, and then put out my fingers so the thumb is pointed towards the patient's groin, and then this finger here, so my index finger, is running along the anterior superior iliac spine, and then my middle finger here is going back on the iliac crest, pointing towards the buttocks, and the site of injection is in the middle of this triangle here. Alright, so this return requires no documentation, and it is 23 minutes now, and thanks for watching.